Hi everyone, Jackson here and welcome back to the channel. Thanks for joining me as I continue on my journey to make new content covering all sorts of things affecting health and well-being. Make sure if you like what you see, give this a thumbs up, comment and subscribe to the channel. Also, if you have liked this, share with your friends. Are you confident that you can properly undertake your monthly testicular self-exam? In this video, we are breaking down exactly how to examine your own balls so you can feel comfortable and confident doing it every month. I've talked before about testicular cancer, but just to review, testicular cancer is one of the most common cancers in young men between the ages of 15 and 35. We'll also talk about why you should check them in the first place. So stay tuned. So before I get into exactly how to perform a testicular self-exam, let's talk about why you should be performing one. Testicular cancer occurs most commonly in men who have an undescended testicle, a history of having had mumps after puberty, or a personal or family history of testicular cancer. There is also a higher potential for those working in the motor repair industry. What you can do is perform a self-exam at least once per month and be familiar with what is normal for your balls. However, the good news is that if you find something early, there is a greater than 95% cure rate for testicular cancer. So while we don't have screening tests for testicular cancer, meaning there's no blood test or imaging test, it's important that we routinely check to look out for signs of cancer. So why can you not leave it for your doctor to examine? Well, when you come in for your annual visit, your doctor typically examines other areas and checks for any abnormalities that impact those areas. But these areas are not the only thing that needs to be examined during your visit. When you visit your doctor, you want to get in and get out as quickly as possible. You may not have enough time for your doctor to spend a lot of time examining your testicles. This is not something you want to do when you are heading out the door and you are rushing. You need to have examined your testicles as well. Therefore, it is really important to get in the habit of checking your testicles every single month so that you know what is normal for you. I'm going to walk you through step by step exactly how to do it. Many prefer to do it in the shower because you are already going to clean that area. Do it then to make it part of your hygiene routine. Use your thumb and index finger and start at the top of the testicle and move all the way down. Also, you want to check the entire tube that sits along the backside of the testicle. It's important to check the entire surface of the scrotum as well. You want to make sure there are no abnormalities there. But remember, just because you feel something doesn't necessarily mean it's cancer. The other thing to consider is what is abnormal for you might be normal for others. For instance, someone may have epididymal cysts. Those are usually pretty easy to feel if you know what to look for. Check that they haven't grown and that they are not causing any pain. Remember to be gentle, as being too vigorous could result in an injury or causing pain that will put you off doing examinations in the future. There should be no pain unless you're trying to push something in, which you shouldn't be doing. Remember, you're looking for any nodules, lumps or bumps that might be concerning. So by doing your own self-exams, you become the expert on your own body and you know what's normal for you. If you find anything, you'll want to bring that up with your doctor. It is better to check something out, have it be nothing, than to regret not checking it out at all. You may be saying yourself, why can't my doctor just check it at my annual visit? If you think about it, when you go to your doctor's office, you're often in a rush. You really do not want to skip or forget to have this examination undertaken. It takes literally less than 5 minutes to perform the exam, and it can potentially save your life. So how exactly do you perform a testicular self-exam? First off, you want to pick a time where you have a relaxed body and you are in a comfortable environment. Well, unfortunately, I can't tell you exactly what to look for. That is the beauty of having your own self-exam, is that you are the expert on your own body and you know what is normal for you. Take your time, relax, and make sure you're comfortable. You can do this in the shower when the water helps to soften the skin. Either way, once you're ready, use both hands to perform the exam. What you're looking for is any nodules, lumps or bumps. If you remember, I talked about epididymal cysts, which are fluid collections along the epididymis. Lastly, you want to check the entire scrotum itself. Sometimes there can be abnormalities in the skin of the scrotum. That could be either cancerous or non-cancerous. If you find anything suspicious, bring it up with your primary care doctor or a urologist. Most of the time these abnormalities are benign, meaning they're not cancer, but it's still important to get them checked out. So I bet you're thinking, okay, tell me exactly what to look for. That is difficult because we are all built differently and you need to know your own body. However, if you're not familiar with what your own body feels like, you may become alarmed when feeling something that's perfectly normal for you. If you find something new, find something different, find something that's concerning, then definitely bring that up with your doctor. If you're nervous about performing a self-exam, I promise you, it's not as hard as you think. First, you want to find the right positioning. So I mentioned earlier that you can do it in the shower. Ultimately, you want to figure out what's comfortable for you. Once you're in your optimal position, You want to support your testicles with one hand and use your thumb and index finger of the other hand to examine the testicle. You're going to hold the testicle in your fingers and roll it gently between your fingers. When you do this, you're feeling the entire testicle. Sometimes people ask, well, how big do these abnormalities have to be concerning? The simple answer is really any abnormality is concerning and should be checked out. It's really important to remember that performing a testicular self-exam should not hurt at all. Remember, you are simply rolling the testicle between your fingers and feeling for any abnormalities. I realize it can be nerve-wracking, but try to keep in mind that most of the time these abnormalities are not concerning. Remember the first time you may feel anxiety and think, oh my God, am I going to find cancer? Am I going to feel something? And I promise you, it's really not that bad. So what are you waiting for? Go check yourself. Hopefully you have found this information helpful. As a new channel, it's hard to build a following, so let me make a promise to you. If you subscribe, I will work hard to improve and keep the information relevant and informative. If you have found this video useful, hit the like, subscribe to the channel and leave a comment below. As always, remember to take care of yourself because you are worth it.